decisions on the African continent where we are throwing a focus on non-communicable diseases. Now, I'm going to set my own question and answer. People ask, why MahamaCares? Why is this not put under the NHIA? There comes a time in the scheme of things where you need to throw a focus on particular disease conditions. And I'm talking about specific
non-communicable diseases.
You know, so for example, I'll give you one example. UNAIDS, where I used to work, a UN agency looking at eliminating HIV and AIDS. When it was set up, people thought, but WHO can do the same thing. The important thing is that UNAIDS has shed light on a particular concern, which at some point was killing millions of Africans and other people around the world. So in this case as well, this is a beautiful illustration of how under the president, we're having end-to-end health coverage. So you look at the x-axis as population coverage, and then the y-axis, which is service coverage. So the blue is actually NHIS as it exists.
So the blue is where you control?
Where we control.
Okay.
Now, if you look at I talked about the fact that 45% of conditions are now under chronic diseases. That's why the Medical Trust Fund or MahamaCares was set up, to close that gap. Now, if you want to turn off the tap when it comes to non-communicable diseases, then you must be catching them early.
All right.
That's where the free primary health care comes in. Preventive, promotive, diagnosing some of these illnesses quickly at the lower centers of health. So we have what we call end-to-end service coverage. We have population coverage where we are trying to get to 100%.
So free primary health care is at the base?
Is at the base.
And this is mostly at the lower level facilities?
CHIPS compounds, health centers, maternity, and even the polyclinics. That's free primary. NHIS is the regular health facilities. What the Medical Trust Fund is doing is providing the training, the equipment, and the general environment for some of these non-communicable diseases to be taken care of.
So does that mean
it's one of the first